Prednisone can be prescribed for a short amount of time or for a really long amount of time. If you're giving it for just a short amount of time, what can you expect? Should you expect no side effects or what? I'm Dr. Megan, the Prednisone pharmacist. I'm here to answer your question today. So, I was prescribed prednisone several times. First, I was prescribed it for a short amount of time. And let me tell you, I definitely felt side effects. I'll dive more into what those really were. But I had plenty of side effects. Then I was given it for a long amount of time. So I'm going to make another video about long-term side effects because some of them are the same and some of them are different. But I wanted to start with this quote from the most well-respected drug reference for pharmacists. And I don't think it's true. What do you think? Short-term administration of large doses typically does not cause adverse effects. Is that how it was for you? Comment below. Did you not have any adverse effects or side effects from large doses of prednisone? Because I certainly did. I had blurry vision. I had achy joints. I had terrible insomnia from just short-term doses. What about you? So I'm going to go through what that literature actually says about what you can expect for short-term side effects. All right? So I've gone through different articles and I'm going to just go through from head to toe what you can expect. So first of all, right here, your brain, your mood, your mental health, what to expect if you're only on prednisone short term. So several studies have showed that if you're only on it for a little bit of time, you might have, there's a special word for it, an improved sense of well-being within several days. Isn't that nice? Another medical term for that is euphoria. You just feel great. Like you've been suffering some disease and now you just feel great. And that feeling lasts a little while. It eventually might go away though. Another, the next extreme of that is called hypomania, where you feel so great, you don't even need to sleep. You just have energy. You feel wonderful and you're kind of almost going crazy. Yikes. So then the next extreme is where your mood goes up and down, and it might be going up and down quite a bit. With that, it can go up so high that you can actually be experiencing mania. And mania is where it's so extreme that you might even need to be hospitalized because you're kind of feeling crazy. So there's different levels, and usually it's just I feel pretty good, but it can get really bad. People can feel terrible anxiety, terrible mania, and you don't want that. I really hope that never happens for you, but it's normal. It's not you, it's the drug. And I've got another set of videos all about how it's really not you, it's the drug, and ways to cope with that. All right, so that we started with the head. Now, moving on. Prednisone can cause lots of eye side effects, but those don't usually happen short term. You might get blurry vision like I did though. Okay, now down to the heart. Prednisone, if it's given in super high doses for a short amount of time, like for somebody who had blindness in their eye from multiple sclerosis, they might be given 1,000 milligrams, and then it would, that super high dose, there's a chance that they could have sudden cardiac death, suddenly die, a heart attack or a stroke or something at their heart. So it's possible, but incredibly unlikely. Usually there aren't a lot of heart side effects when it's short term, but it can happen. Okay, the next one is moving down to the adrenal gland. in your kidneys. So the adrenal gland is what secretes your normal hormone, cortisol, that prednisone is replacing. And so when you're taking prednisone, you're replacing that cortisol, and it's turning off your adrenal gland and your hypothalamus in your brain. That whole system is turned off. And that can happen in as little as 1 dose. So that side effect can happen immediately. Pretty much everybody who's given prednisone or another steroid is immediately adrenal suppressed. And it takes time to recover. And that's why we usually taper prednisone slowly off. But if you're only on it short term, sometimes you can get away with just taking high doses and not tapering. But that's an exception and not the rule, and you should definitely follow whatever your doctor ordered. Okay, the next one I'm going to talk about is your muscles. So prednisone breaks down muscles, and they can cause something called myopathy. And that can happen, it said, in as little as weeks to months. So you can notice that your arms and your legs and maybe even like the muscles in your hands can get weaker and smaller and like fall apart, and you lose them. And so that can happen. The next thing that's related to that is weight. So you're losing muscle mass. That's something you're losing. But what are you gaining? You are gaining water weight and fat weight. And that doesn't usually happen right at first. If you're only taking prednisone for like 2 to 3 weeks, you usually don't gain weight. You actually might even lose weight during that first short period of time. But beyond 2 to 3 weeks, that's when the weight gain can happen. And when the weight gain happens like that, it can start as low as 5 milligrams, and it can be up to 10% of your body weight you can gain. I definitely did. And now I've learned so much about how not to do that. But it happens, and it's no fun because it's not just weight, it's changing your appearance. When I make these videos, sometimes the text at the bottom, it thinks I'm saying pregnant zone instead of prednisone. And it couldn't be a truer word for it because it might give you a big fat belly and a big round face. But those things don't usually happen when you're only on it for 2 to 3 weeks. Moon face usually takes a couple months to appear. It can happen faster, but it usually takes several months, like at least beyond a month, to start showing up. And if you're having a different experience, let us know below, because there really just aren't great lists of any of this information. I've had to pull all of this from all over. And so if you're having a different experience with your short term, let's collect that great information. All right, next is my true reason for disagreeing with the statement from the the most well-respected pharmacist literature out there, clinical pharmacology. They said this about prednisone: short-term administration of large doses typically does not cause adverse effects. To translate that into English, they say if you only take it a short amount of time, it doesn't normally cause side effects. And I have to completely disagree because of this study. This study, they looked at over 300,000 adults who are insured by a health insurance company in America. And they looked at 3 years of information. And of those 300,000 people, 1 in 5 were given at least a short course of steroids. 1 in 5, 20% of people were given prednisone or another steroid for less than 30 days. And in that time period and the follow-up time period, there was a 5 times greater risk of sepsis. That's like your whole body being infected and like nearly dying. There was a 5 times greater risk. Now, your risk of sepsis is really, really small to begin with, but while on prednisone or another steroid, the risk was 5 times greater. So, like, that's not insignificant. That is definitely statistically and very clinically significant. The next one was BTEs, which is a venous thromboembolism or a clot. They said that you had a 3 times greater risk of having a clot. Now, again, your baseline risk is pretty low. So getting a 3 times risk, it's not like everybody's going to suddenly have a clot. But when they looked at 300,000 lives, they could see the difference. Now the last one is fractures, broken bones, because prednisone causes bone loss. It leaches calcium out of our bones. And so I was surprised to read this. I thought it was kind of a pushed it out there, like if you've been on prednisone a long time, then you're at greater risk for osteoporosis and breaking your bones. They said that you almost had a 2 times greater risk of breaking a bone during that short term, less than 30 days, those first 30 days of taking prednisone. So if your doctor prescribed prednisone or another steroid and you're wondering, does it cause side effects in a short amount of time? Because I know doctors say that all the time. Oh, you're only on it for a short amount of time. You won't have any side effects. It's not true. You probably will have side effects. And you probably aren't going to have these terrible ones. They're really rare. But you'll probably have change in your mood or personality. Probably have change in your sleep. It might make you have insomnia. And it might change your appetite. Those are the top 3 things that people notice. So I invite you to let us know if you've had a different experience than that in those first 10 to 20 days of taking prednisone. And if you have, let's make a better list. And then if you are on prednisone, I've created a prednisone checklist, and it has ways to cope with the top 7 mistakes that people make while on prednisone, and the top 15 side effects, different specific things you can do to combat them. You can get it. I'll post a link below. Signing off as Dr. Megan, the prednisone pharmacist.